is the pathological calcification. So already we studied about the necrosis, the various types of necrosis we have studied. Then we went for the gangrene. So various types of gangrene also we have studied. Fine. So today we'll be discussing about the calcification. The name itself will tell pathological calcification. Pathological means under the condition of the disease there is a calcification. So normally the your bones, it contains calcium. Your enamel, that is teeth, it contains calcium, and some amount of calcium will be present in the body, that is in the extracellular fluid, in order to cause the depolarization process, that is in the physiology of muscle contraction. But if there is a deposition of calcium inside the tissues, pathologically, it is called as pathological calcification. Deposition of calcium in the tissues other than osteoid means osteon, that the structure of the bone. The tiers of the bone shows you the Harvesian canal, lamellae, lacunae, then all together it will form a osteon. Okay, so this, not only this, in the enamel in the sense your mouth, and that is the teeth. So the deposition of calcium salt other than these tissues is called as the pathological calcification or heterotrophic calcification. So they are divided into two types, that is dystrophic calcification. They are recognized as dystrophic and metastatic calcification. So there are two types of calcification. We'll be doing only this topic today, so only this is enough. So one is the dystrophic calcification, the other name is metastatic calcification. The name dystrophic, dystrophia means it is damage, that is damage to the cell or death of the cell. Okay, that means there is a calcification if the cell has undergone the death, or suppose if the cell has undergone the injury due to various uh, etiologies, that is physical agent, chemical agent, biological agents, then free radicals, ischemia, hypoxia. There are so many things which can induce the cell injury, that we have studied. So this is termed as dystrophic calcification. The term dystrophic means it is the death, or degeneration of the cell, or the death of the cell causes the calcification in the tissues. So this is called as dystrophic. So we have the one more calcification. So the term is called as, the name it is named as the metastatic calcification. Metastasis, this term we will be studying in the tumors, that is in the chapter of the cancer. What is metastasis means? You already know our Indian cricket player Yuvraj Singh. He had cancer. He was suffering from cancer, and it was cured. So uh, there are two types of cancer you have to know. One is a benign and one is a malignant. Malignant is the most dangerous one because it spreads all over the body, whereas benign is the first stage of the cancer. So, and the cricketer Yuvraj Singh had a benign tumor, so it was later cured. But once the benign tumor starts growing in the body, so if it's not recognized, it is not diagnosed, so the person doesn't know that he is having a cancer. What happens is, slowly from one side, suppose he is having a cancer in the site of the liver cancer he is having, hepatoma we can call, hepatocytoma, whatever it is. Okay, he is having the cancer in the region of the liver. So from liver the cancer arises, and then the cancer will spread out to all the parts of the body, in the sense, from one region it will undergo the metastasis in the sense it will undergo the transfer from one place to the another. So from certain foci, that is the liver was the foci in which the cancer was developed, from there it can pass on to the stomach, intestine, pancreas, so and so. So to various regions it can move through the blood. So such kind of term is called as metastasis, that is a transfer from one place to the another. And this calcification, that is metastatic calcification, occurs there is a transfer. So it mainly happens in a normal cell, but this dystrophic calcification occurs in already degenerated cell or a dead cell, that you have to remember. So these are the two types of calcification. And once again, this is a 5 marks question, very very important for the examination. So whatever I did till today, you can just uh, glance the question bank. In the question bank it is given that uh, whatever the things I have done, everything is there in the question bank. Whatever the questions I have given till today, everything is there. Whatever the questions I give as an assignment, everything is very 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 important. Okay, this question chapter carries a lot of marks, that is sometimes it will start from around 20 to 30 marks also, sometimes question will come. So this chapter is very very important, and this is the basic terminologies, so basic things that if you know this, the later on whatever the diseases will come, you can understand easily. So we'll go with the first one, that is the dystrophic calcification. It is characterized by deposition of calcium salts in dead or degenerated tissues with the normal calcium metabolism. That means there is a normal calcium metabolism will be there. The calcium metabolism will be normal. Along with that, there is a normal serum calcium level. That means in the blood serum or sera or the plasma, the calcium level will be same. I mean, it is normal. Whereas there are two types under the dystrophic calcification. The first one is the calcification in dead tissues. That means already it has undergone necrosis in such tissues. The first one is caseous necrosis. I guess so. You know this. What is caseous necrosis? Mainly in the condition of tuberculosis, there is a formation of a cheesy foci, and it doesn't have proper border. There is an inflammation in the region, and the region will look whitish, creamy, or yellowish white in appearance. That is cream color appearance you can find. So such kind of a necrosis is called as caseous necrosis. In case of tuberculosis, is the most common site for dystrophic calcification. That means in TB, in the condition of TB, you can expect dystrophic calcification in the region, and this dystrophic calcification is in such a way that the calcification contains your bacilli as well, that is TB bacilli, mycobacterium tuberculi bacilli. You can expect that in the calcified tuberculosis lesions or droplets, and lymph nodes. In the lymph nodes also you can find, and in the lungs you can find such kind of a calcification. Next is liquefactive necrosis. You know what is liquefactive necrosis? In chronic abscess may get calcified. That is, in the chronic infections or chronic death of the cell can lead to this calcification in case of the uh, liquefactive necrosis. And also you can expect uh, the region will be what we can call uh, it will be foul smell. Okay, it is highly degenerated, the cells will be dead, it will become black, foul smell. Okay, so next one is the in and you can expect in that region the calcium, that is calcium salt deposition. Next is fat necrosis. The following the acute pancreatitis, that is after pancreatitis, that is inflammation of pancreas, which is acute, not chronic. Acute means which can be which is at a first stage. If it's prolonged, it can turn into a chronic. Or a traumatic fat necrosis, that is due to the trauma, that is the deposition of fat soaps. So these fat soaps contain calcium soaps. So this in case of the breast. Okay. Then microcalcification in breast cancer and can be identified in the technique called as mammography. Mammography in the sense uh, just like ECG, electrocardiography, there is a technique to check whether the mammary gland is secreting proper secretions, whether their cells or the alveoli present in the mammary glands are proper, just like a X-ray. They are doing a graphy technique. Okay. Calcification in degenerated tissues. So already we studied about the dead tissues, that is necrosed tissue. Now we'll go with the degenerated tissues. Dense old scars may undergo hyaline degeneration and subsequent calcification. So what is this scars? I guess so you know the Harry Potter movie. He has a Z scar on his forehead, that is right side of his forehead. You know it now if you have seen the movie. So what is this scar? Means if a person undergoes accident, if he has met accident, so if he is wounded, deeply wounded, so you can see after few days the wound will be healed, and there is a fibroblast which causes the formation of collagen fibers. The collagen fibers will form uh, uh, scars. Okay, scars, and that scars there is a higher chances dense old scars. Sometimes the dense old scars undergoes hyaline degeneration. Okay, hyaline degeneration, it will turn out into a reddish in appearance and degenerated, and there is a calcification also you can find. Then atheromas in aorta. The term atheroma means atherosclerosis, that is for deposition of the fatty plaques in the walls of the arteries, mainly in the aorta here. So all atheromas of aorta and coronary arteries, coronaries in the sense coronary arteries, frequently it will cause scarring in the blood vessel, and there is a rupture of blood vessel, the damage of the blood vessel, and uh, thereby there is a calcification you can find. And also goiter. Goiter, you know what is a condition? There is a excessive hyperplasia. Hyperplasia means there is a increase in the size of this thyroid gland due to the increase in thyroid cells. Okay, or the thyroid follicles. So this lead to the goiter, that is the size of the thyroid gland increases. So presence of calcification in the areas of the degeneration you can find in case of the thyroid gland, in case of the goiter. Cyst can also be present. For a cyst with which have been present for a longer time can show the calcification. Suppose in case of epidermal means skin cancer, and pilar cyst in the sense the cyst you can find in the pili, that is in the hairs. Okay, also you can find such kind of a calcification. So next is metastasis. I told metastatic calcification. I told what it is. It is mainly seen in normal tissues due to the hypercalcemia. Hypercalcemia means hyper means more, calci means calcium, emia means blood. Hypercalcemia. It causes would include the causes may include excessive mobilization of calcium from the bone. From the bone, excessive calcium can move towards the other sides. Then absorption of calcium from the gut. So the gut is the main site of absorption of calcium, mainly under the influence of vitamin D. Vitamin D, mainly the source of vitamin D is sunlight. So sunlight, the skin will absorb the sunlight, and it will help in the generation of vitamin D. The vitamin D, as the sun as a source of vitamin D, it helps in the absorption of the calcium in the gut. Mainly, it is the mechanism. Okay. Leave about that. We'll be studying that later. We'll understand. First one is excessive mobilization of calcium from the bone. So if there is more and more mobilization of calcium from the bone, there may be chances. Uh, so more these causes are more common. So how this calcium will move, in which condition it will move from the bones, is hyperparathyroidism. So what is the function of parathyroid gland? Mainly helps in the absorption of calcium and phosphate from the renal tubules. Okay, so it will maintain the calcium and phosphate level in the blood. But in case of hyperparathyroidism, means uh, there is excessive movement of the calcium from the bone to the blood. Why and how is parathyroidism? Hyper means more, parathyroidism means the parathyroid gland causes hyperplasia. Hyperplasia means I told about when I told about the gout. I mean, it's not gout, goiter. Okay, what happens in hyperplasia of parathyroid gland is the size of the parathyroid gland will increase. How is mainly due to the excessive number of increase in the cells. So increase in number of the parathyroid cells, mainly in the case of parathyroid adenoma. Adenoma means cancer of the parathyroid gland. And secondary in such case of hyperplasia, mainly due to the increase in number of cells in the of the parathyroid gland, and chronic renal failure as well. Renal failure means uh, blood cannot I mean the calcium level is not properly maintained in the body. There is excess of calcium in the blood. So that blood the calcium in the blood, I told what is the main function of uh, the parathyroid gland is it will maintain the calcium level in the body. Okay, and it can also reabsorb, and it can also excrete, helps in the excretion of this uh, calcium. So what happens is, in case of chronic renal failure, the kidney cannot filter off the excessive calcium, and it is now still present in the blood. So calcium may be reabsorbed, or it may be present in the blood now. So that blood calcium level, sera level will increase, and the later it will move toward the various tissues. Okay, in the tissues it will get deposited in normal tissues as well. I hope you understood. Parathyroidism means, hyperparathyroidism means size of the parathyroid gland will increase. So as a result, more and more the what is the main function of parathyroid gland is to maintain the calcium and phosphate level. That means it can excrete the calcium, and thereby it will maintain the calcium level in the blood. But if there is some adenoma, that is a cancer of parathyroid gland, more and more parathyroid glands are present, and in case of chronic, I mean, more and more parathyroid cells are present, and it can lead to such kind of a problem. That means it leads to the excessive release of the calcium from the bones, and the blood calcium level will gradually increase. Okay, or secondary, in case of parathyroid hyperplasia, size of parathyroid glands increases, and also chronic renal failure, the kidney cannot filter off the normal amount of calcium. Okay, thereby the calcium level in the blood will gradually rise up. Bone destructive regions such as multiple myeloma, that means in case of bone cancer also it can lead to such condition, that is excessive calcium level. Metastatic carcinoma, that means I told carcinoma which spreads, that is malignant tumor. In case of that also of the bone, it can lead to this condition. Hypercalcemia as a part of paraneoplastic syndrome. So hypercalcemia as a part of paraneoplastic syndrome. So in case of breast cancer also there is a higher chances of the calcium um, in the tissues. Prolonged immobilization. So if the person doesn't move, there is a tissue wasting, that is atrophy of the bones, and there is a hypercalcemia can be caused. The person doesn't move properly if he sits for a longer time or sleeps in a place for a longer time, so there is a higher chance. That means he is a bedridden patient. In that cases there is chances. Excessive absorption of calcium from the gut. So next we'll go with this. Less often excess calcium may be absorbed from the gut, causing the hypercalcemia and metastatic calcification. In case of hypervitaminosis, that means excessive vitamin D, thereby the excessive intake, or sarcoidosis, that means excessive calcium in the blood. Milk alkali syndrome, caused by excessive oral intake of the calcium in the form of milk, and also administration of calcium carbonate in the treatment of peptic ulcer. Whereas idiopathic hypercalcemia of infancy, that means in infant, idiopathic means the reason is unknown. The term idiopathic means if the etiology is unknown, the term is called as idiopathic or idiopathy. Okay. Next, renal causes such as in the renal tubular acidosis. If there is excessive H plus level in the renal cells, that is renal tubular cells, there is a higher chance of getting the calcium, because calcium won't be filtered out of the, calcium won't be reabsorbed, or calcium won't be secreted from the blood into the uh, renal tubules due to acidosis. Okay, so let me conclude here for today. Have a nice day. Take care. Bye.